October is Breast Cancer Awareness Month, and our very own Youmna Naufal talks to Dr. Labib Ghulmiyyah about what women need to know. On to you, Youmna.
Thank you, Linda. Yes, every 69 seconds, somewhere in the world, someone dies from breast cancer. It is the most prevalent cancer among women today. Women at high risk for breast cancer may choose to undergo active surveillance and get tested regularly. But another option is to remove both breasts, a procedure called a double mastectomy, which can reduce the risk of developing breast cancer by approximately 90%. In our studios today to discuss this further, we have the pleasure to welcome Dr. Labib Ghulmiyyah. Dr. Ghulmiyyah, how are you?
Hi, how are you?
Thank you for being here.
Thank you for having me.
You know, the double mastectomy really took light when Angelina Jolie published an article back in May saying she had both her breasts removed because she took a test that revealed she had the infamous, and tell me if I'm pronouncing this right, BRCA1 gene mutation, which gave her an 87% of getting the cancer.
I think what happened was really a good and a bad thing at the same time. I mean, you know, when a celebrity does something, people would follow. What Angelina Jolie did is basically she found out she has the BRCA gene, and she went all the way to remove her both breasts, which is a way to do it, but really it's a bit, you know, aggressive. We don't like people to do this.
Her mother had breast cancer.
Yes, her mother and her aunt too had ovarian cancer. You know, breast and ovarian are related. So we're not telling people to, you know, go all this way to do what Angelina Jolie did, but they should know at least their history, their family history, go get tested. And now, you know, October is the Breast Awareness Month, but no, every month of the year should be an awareness month for breast cancer. So,
how accurate are these tests? The ones, the gene tests that everybody is taking.
Actually, most of the breast cancers, and for people to know, are not related to BRCA. It's only maybe 5 to 8% are related to the BRCA genes. The rest are not. They could be genetic, but they're not related to this gene. The gene is, you know, quite accurate when you get tested, but you know, every person has a different mutation. Every race has a different type of mutation. For example, you know, in the United States, the mutations are different than the Lebanese woman. And fortunately now there are scientists in Lebanon working on trying to find what are the most common mutations or, you know,
so
problems
somebody,
in this
if
gene.
a woman comes to you today and says, I have an aunt or a sister or a mother with breast cancer, I want to take the gene test and see what the results are, would you recommend she does? I mean, these are expensive tests, we know, and then there's, of course, the findings and the consequences of finding out.
Well, the best thing to do is to test the person who had the breast cancer, test their genetic makeup and know where the mutation is, and then look for this specific mutation in the other, you know, daughters or siblings or whoever, because it will be much cheaper. But not everybody that has a family history of breast cancer means they have the BRCA gene. It has to be somebody who had it really at a young age, you know, in their 40s and their 30s. Not, you know, if her grandmother had it at 60, it doesn't mean she needs to be tested for BRCA.
Right. Moving on from BRCA, early detection is what everybody talks about and how important that is in tracking breast cancer.
That's the message we want, you know, people to know. And I think the Ministry of Health in Lebanon has done a great job, you know, in the last few years, you know, letting people know that, you know, mammographies are there. Early detection really does make a difference. We know we have scientific evidence that early detection does decrease the mortality from breast cancer. We know this especially after the age of 50. Between 40 and 50, really, the studies are kind of mixed, and it depends on what country you're talking about. But in Lebanon, 50% of breast cancer are in women less than the age of 50. So really, we have to start at the age of 40 to do
mammograms, to do specific mammograms.
Yes.
I want to talk about something that's been taking more light today, is that we are seeing more and more women who are younger get breast cancer. We're talking as early as 20s and 30s, and according to what I've read, the cancer, the breast cancer, is usually more aggressive when you're in your 20s and 30s. Why are women getting it younger?
Honestly, we don't have, you know, answers, but, you know, yesterday I was reading an article from the WHO saying, you know, lung cancer and other types of cancer are increasing because of environmental toxins. So maybe breast cancer has to do with this. Of course, using birth control pills, hormone replacement, all of this increases your chances. You know, our lifestyle, you know, obesity is much more common nowadays. Smoking, drinking alcohol, all this has, you know, increased in Lebanon and in the world. But actually,
can you just tell me why the cancer, the breast cancer, is more aggressive when you're in your 20s and 30s? I know it's because the tissue of the breast is thicker and it's harder to detect it. Am I right?
We really don't know why it is aggressive, but you know, catching it sometimes we catch a little bit later because women will come and tell us, I have a breast lump, I'm feeling weird, there's pain under my armpit.
How important is it to have your own examination?
I think it's very important, to teach young girls to start, knowing yourself, like knowing your family history, asking your mom, your grandmother, was there anybody had breast cancer, and know your own body.
Usually, you check for your breast about a week after your premenstrual.
Yes, it's better to check it after your period because the breast tissue will be, less dense, and you could,
and we have
won't be
pictures,
painful too.
We have pictures to show exactly how that's done. Also, if you feel anything, what is it that we can feel? What is it? How does it work usually?
Well, the breast is a gland basically. There's a lot of glandular tissue, so you could feel small lumps under your fingers, but if you know that these are there and they're normal, anything that's abnormal, if there's a change in the skin, if the nipple is inverted, goes inside, if you feel something unusual, please go and ask your family doctor, your gynecologist, anybody. Any physician can help with this, and then they can refer you to people that do breast cancer or breast health in this country.
Treatment is, if you find out about it early enough, the treatment is usually the typical chemotherapy, radiation, even surgery these days.
Yes.
And do a lot of women have breast cancer in Lebanon?
Well, from the statistics we have, yes, it has been increasing. Looking at world numbers, in the 90s to the 2000s, it was increasing, but then it's been stable all over the world, except in Lebanon. We're seeing it more and more because I think people are getting the mammographies more, and we're detecting these early breast cancers.
Mammographies after the age of 40. Would you recommend it before 40?
I would not recommend this before 40 unless the woman has a lifetime risk of breast cancer, let's say more than 15 or 20%. And this can be calculated when you go to your physician, you tell him, or tell her, my mom had breast cancer, I took birth control pill, I have no kids, I didn't breastfeed my all this.
Right, and I know we were, because we had met earlier, you and I, and we spoke about how important it was for women to breastfeed because that actually decreases the chances of breast cancer.
Yes.
Am I correct?
It helps tremendously decrease the breast cancer incidence, as well as, of course, all the benefits. We know we can talk hours about breastfeeding, but breastfeeding does decrease your chance. So what I was saying is you stratify women into groups: low risk, moderate risk, and high risk. High risk women need to be screened earlier.
High risk if your family or somebody in the family has it, if you're on birth control pills, or if you haven't.
There are several parameters where you can plug them into a model.
And you can go to your gynecologist.
Yes, and he will do this, and he will tell you your lifetime risk is, let's say, 20%. Okay. This model is not great, but it helps us at least know who should get the mammographies early on.
Whenever we're talking about breast cancer, and this is all over the place, whether it's breast cancer or exercise, or everybody recommends a healthy lifestyle, we have to go through it. Can you tell us what is recommended that could possibly reduce the risks of breast cancer?
It's logical.
Right.
Avoid tobacco, avoid nicotine, and all the problems with it.
Any specific foods? Obesity, I was reading soy. I was reading salmon. I was
recently there was
greens.
a study about peanut butter, decreasing the risk of breast cancer. So I think there are things that will once you have more fat in your body, you have more estrogen. And estrogen is probably one of the culprits for breast cancer. So decreasing fat in your body will decrease probably your risk of breast cancer. Exercising, will help, the tissues perfuse better. It's just living a healthy lifestyle without, using too many, let's say, detergents or, stuff that can affect your breast.
Right, they say a lot of...
And examine yourself, know yourself well, see your physician every year. After 40, start doing, mammographies earlier if you are somebody who is high risk.
Okay. Anything else we can take away from today's session from a gynecologist, and now having you here, let's take advantage of it.
And I think, the message I want to tell, people is, go see your gynecologist or your physician or your family doctor early on. Even if you're, 20, 19, you can just sit down, talk about, strategies, how to, prevent this breast cancer or any type of cancer that you know, women are prone to. Of course, know yourself well.
Your family
history is extremely important. You know, the Ministry of Health is offering free mammographies in the governmental hospitals. So, you know, I think people should take advantage of this and
especially
go get
now
tested.
in Lebanon, because they're
women
increasing.
hate the mammography. I know, they keep telling me it's painful. You know, they're gonna squeeze their breast and it's uncomfortable. Nowadays, the mammographies are less painful. You know, the pain or the discomfort is only for, you know, maybe a minute or two, but it will save lives for sure, and it will save, you know, families from losing their mothers or their daughters or, you know, their sisters. So that's the message I want people to.
Thank you so much for being with us today.
Thank you.
That was Dr. Labib Ghulmiyyah to talk about Breast Cancer Awareness Month. Back to you, Linda.